Testing. Oh, it's not.
Sorry, that is
I'm too tall.
actually hard. Might have to just hold it, actually. Yeah.
Testing, testing.
Okay.
Okay, I'll try to talk loud. Ready? Hi, good morning. My name is Rebecca Gibron. I grew up in a large, very conservative family in Kansas, where girls were not provided much, if any, information about sex or their own bodies. I just knew that I didn't want to get pregnant and trapped in bad situations. I wanted to go to college, and I desperately needed facts. As a nervous 16-year-old, I walked into the Boise, Idaho Planned Parenthood clinic, where I met Dixie, the most compassionate and caring nurse practitioner. She made me feel protected and safe. She answered all of my questions, prescribed me birth control, provided education and information about sexually transmitted infections. She taught me how to make informed decisions to control my own destiny. In the years that followed, I knew that Dixie and Planned Parenthood would always be there for me. Now, as the CEO for Planned Parenthood's largest affiliate, covering Indiana, Kentucky, and 4 other states, I'm here to tell Hoosiers, Planned Parenthood will always be here for you when you need us. We are not going anywhere. Planned Parenthood's 11 health centers in Indiana will still be here next year and the next decade. Planned Parenthood of Indiana will not be intimidated and bullied, and we will not be silenced. 1 year ago today, extremists banned abortion care for more than 1 million people in Kentucky. We didn't let them bully us there. Our Planned Parenthood health centers in Kentucky are still providing essential reproductive, sexual, and gender-affirming health care to tens of thousands of people. Right now, Planned Parenthood in Kentucky is helping folks access abortion care in nearby states where it is still available and protected. Our commitment to Indiana is no different. Today is a dark day for millions of Hoosiers and others who rely on Indiana Planned Parenthood for abortion care. When radical extremists on the Supreme Court overturned the 50-year-old constitutional right to abortion last year, they plunged our nation into a healthcare crisis. Until today, Indiana was the region's pivotal state for preserving abortion access for people in the region. Our appointments were booked out for months. But now extremists are taking away abortion care in Indiana. Abortion bans are discriminatory. They prevent access to reproductive health care for people of color and those working to make ends meet. Indiana's abortion restrictions target Hoosiers of color, indigenous communities, and those already marginalized by our healthcare system. We are here today to assure all Hoosiers, whether you're white, Black, brown, or indigenous, whether you're straight, gay, or trans, whether you have health insurance or you're uninsured, Planned Parenthood will never back down, not now, not ever, from providing you the care that you need. I repeat, Planned Parenthood of Indiana will not back down. We will be courageous in the courts and courageous in the clinics. Planned Parenthood will not be silenced. We will turn up the volume, making sure everyone has access to medically accurate information about how to get abortion care in other states. Indiana Planned Parenthood Health Centers will continue to provide our long list of essential healthcare services. including support to help patients access abortion in other states, emergency contraception, birth control and vasectomies, pre and post abortion care, STI testing and treatment, pregnancy consultation and ultrasounds, cancer screenings, gender affirming hormone care for people over 18, wellness visits, and so much more. Our patient navigator team will help guide patients through the process of getting abortion care out of state, connecting with abortion funds, and providing follow-up care when they get back home. I repeat, no matter what extremists try to do in the political corridors and courtrooms of Indiana, Planned Parenthood will keep providing Hoosiers with birth control, vasectomies, STI prevention and treatment, gender-affirming care for adults, and referrals to abortion care in other states where it is protected. Our patients are our North Star. The people we provide care for are the people that we keep in our heads with every decision that we make. Every person in every circumstance deserves access to health care when and where they need it. No matter what extremists are doing to attack your rights and your choices about your own bodies, Planned Parenthood will be here for you now more than ever. Planned Parenthood healthcare centers in Indiana are here with open doors today and will be here tomorrow and every single day after that. With that, I'd like to introduce Dr. Katie McHugh.
Thank you, Rebecca. And thank you all for being here this morning. My name is Dr. Katie McHugh. I'm a board certified OBGYN and a proud abortion care provider here at Planned Parenthood in Indiana, where we are incredibly proud defenders of abortion care. I've been a physician for 12 years, and abortion care has always been a priority in my career. I chose to provide abortion care because this is life-saving and life-affirming care. There is no greater honor than helping someone regain control of their life. That is exactly what we do when we provide abortion care. When I started my journey to become a reproductive healthcare expert, I did not think my job would involve press conferences. More specifically, I did not understand that my home state would train me to be a highly skilled physician, only then to ignore my expertise, skills, and knowledge, and more than just ignore, to criminalize my work, to put physicians in jail for this care, and only for political purposes. Right now, nearly half of the country is passing total or near total bans on abortion, bans that have nothing to do with people's health or well-being, bans that harm the most oppressed and marginalized people in our communities. And today in Indiana, hundreds of thousands of people will be refused the care that they need and deserve. We will tell them that they have to leave the state. We will help arrange their travel and their care in other states, and they will have to travel hundreds of miles to reclaim ownership of their own bodies and futures. Or perhaps they will be so confused by the legal landscape that they will give up and not even try. Historically, we know that when abortion care is not available and not accessible, people become desperate. And that is exactly what we have seen already in Indiana over the last year since the passage of SEA 1. We've seen patients attempt to end pregnancies through dangerous means when they felt there were no other options. We've seen assault survivors struggle to meet the deadlines imposed by the state to terminate a pregnancy. We've helped so many for whom this is not the right time to expand their family. And these are just the stories of the people who find us. Imagine all the people who never make their way to care. We are here because what's happening in Indiana represents what's happening everywhere. Politicians are so out of sync with what the people want, the people that they are supposed to be representing want. Over 70% of people in Indiana support access to abortion care. But instead of supporting patients choosing abortion, like children or rape survivors or people with life-threatening conditions, the state instead denies basic health care. And meanwhile, healthcare providers and soon patients are being targeted and attacked by our state. These tragedies are not the exception, they're inevitable outcomes. And when you consider Indiana's abysmal maternal and infant mortality rates, it is clear that this ban isn't about protecting life. Even worse, politicians are funneling taxpayer dollars to fake medical clinics whose goal is to shame and manipulate pregnant people. Crisis pregnancy clinics are not regulated. They are not run by medical professionals, and they intentionally deceive people seeking pregnancy termination, interfering with appropriate and timely medical care. They place themselves just next to actual medical centers to confuse patients. And if you don't believe me, look next door. With an abortion ban in place and even more funding heading their way, we anticipate that these fake clinics will become even bolder and will ramp up their lies and deception in an effort to force patients to stay pregnant against their will. No one should be subjected to healthcare deception from fake health clinics, and no one should be forced to undergo pregnancy when they don't consent to it. Our most basic expectation from our healthcare system should be to receive accurate and truthful information. Patients need and deserve access to legitimate healthcare providers and information. Providers who will offer them a full range of pregnancy options, including local abortion care or assistance traveling out of state to access that care. The American Medical Association Code of Ethics says, physicians have an ethical responsibility to seek change when they believe the requirements of law or policy are contrary to the best interests of patients. And this is exactly why we are here today. Our patients are our passion, and we aren't alone. As healthcare providers, we will continue this fight. We will fight for access to abortion in our communities covered by insurance. We will fight for the reproductive freedom to control and define our futures. And we will fight against abortion, shame, and forced pregnancy. No matter the landscape, abortion is here to stay. And so are those of us who provide abortion care. We are here to help the people in Indiana access the health care that they need. And we invite the community to join us. We challenge all Hoosiers to stand up against this oppression and to reclaim the right to control our bodies and our futures. This is not the first battle, and it will not be the last. And with that, I am so proud to be here today with another soldier in this fight. Dr. Rick Henderson is a resident and OBGYN in training at Indiana University, and I'm proud to be here with them today.
Hi, everyone. Can you hear me okay? Oh, a little bit closer. Okay. Hi, I'm Dr. Rick Henderson. I'm a second-year OBGYN resident at at Indiana University. And thank you for letting me be here today to talk about this. Before I start, just want to say that I'm here on behalf of myself, and these viewpoints are my own and not representative of my employer. Before starting residency, people told me I would be tired. And I couldn't even imagine how tired I would be as an OBGYN intern. I heard about how I would spend weekends at the hospital, how I'd arrive home late for dinner. And they were right. I am tired. I do spend a lot of my weekends at the hospital, and I often arrive home late for dinner. But what they didn't talk about was how much I was going to love it. And I do love it. I love practicing alongside my co-residents. I love learning from my mentors who are leaders in their field. and I love most of all caring for my patients. I've come to realize that participating in a patient's healthcare, helping them reach their goals, is a sacred act of trust between me and my patient. That promise that I make to them is to put my patient's well-being as my top priority. It's a commitment to put the long hours aside and to wholly focus on the person that I'm caring for at that moment, ignoring all outside influence. Unfortunately, the Indiana state legislation has found its way into my exam room by means of SEA 1. This legislation directly affects and prevents me from being able to provide the safe, evidence-based healthcare that my patients need. I fear that SEA 1 is going to deter young physicians from staying in Indiana, where the care is often needed the most. This is not only a factor for OBGYN residents, but medical trainees of all specialties. Young physicians in Indiana have to grapple with the decision of protecting themselves, their families, and their careers versus providing safe care for our patients. We see the attacks on our mentors. We have to seriously consider if we will accept similar risk going forward in our career. This decision looms on us over and throughout our residency. And at the end of our training, some of us will stay and others will leave for less restrictive abortion laws in different states. For those who make the decision to leave, the decision is not reflective on how much we care for our fellow Hoosiers. It's the direct result of the state legislation introducing fear into our medical practices. The immediate and lasting effects of this legislation cannot be understated. Not only will this legislation affect those who are seeking safe abortion care in Indiana, but it will affect generations of Hoosiers who will be impacted by physician shortages. In closing, we are eternally grateful for those who have come before us and those who are staying in face of such persecution. Their strength is what gives us hope that someday future resident physicians won't have to struggle with similar decisions. Thank you.
Thank you all for being here today. We're available for questions if you all have any questions you'd like to pose.
So with the latest filing late yesterday, technically the ban hasn't taken effect yet. It might not take effect today. It could take effect at any moment, it seems. What do you say to patients right now who show up at your door saying, can I still access care right now?
Yeah, I want to be clear. The filing that we submitted yesterday is to ask the Supreme Court for an injunction while we still litigate this case in the courts. It does not impact our ability to provide abortion care. The law prevents abortions from being provided in clinics. What we're trying to continue to litigate in the court is clarification on really confusing exemptions that are really there in name only, so that we can understand and providers and patients understand how, where, and when they can legally access abortion care in the state of Indiana.
Right, just to follow up on that. So that's the injunction you're now asking for, which wouldn't affect your ability to provide abortion. This the law says basically bans abortion clinics. But the previous injunction, which, as far as I'm aware, extended this part of the law about abortion, is now still in place because the ruling from June hasn't been certified because we're waiting for it to act. So I guess I'll say again, is there any chance of abortion clinics still being able to provide abortion care right now?
You know, as of today, abortion services have stopped in the state of Indiana. You know, it's really difficult. You know, as I said earlier, patients are our North Star, and we center them in every decision that we make. And it's not patient-centered care to try to have patients navigate through this chaos and turbulence at the whims of extreme lawmakers.
So you ceased providing abortion care
As of today, yes.
Are there see anything happening with court battle that might be able to assume, or is it with it taking effect that the abortion clinic license being revoked? Is that not likely to be able to overcome?
Yeah, I think, I want to be really clear that abortion is banned in the state of Indiana. All we are asking the court to do is to provide further clarification on the supposed health exemptions and where abortions can be provided in those instances.
Travel out of state for abortion care. Are you concerned about any repercussions from the Attorney General trying to get into your patient files and find out who you have provided that assistance to?
Absolutely not. What you're referencing is, Todd Rokita and 18 other attorneys generals signed on to a letter insisting that they should have rights to private patient medical data. And what I want to make crystal clear is under no circumstances will we turn over any kind of patient data. Your records, your medical information is private and protected and confidential, and it will remain that way.
Will you continue to fight with the current lawsuit, since while the injunction may be lifted, the still have the lawsuit going on in Monroe County? Do you intend to continue pushing that lawsuit?
We will fight every lawsuit and every ban as far as we can take it in the state of Indiana. Patients deserve access to vital reproductive health care in their home state. It is unconscionable to think that patients have to leave their community, their home, their state to access basic health care. So yes, we will continue to fight as far as we can fight every battle that needs to be fought on this front in the state of Indiana.
This
Yesterday, the last time that you were
Yeah, our schedules have been packed for the last full month. As I said earlier, Indiana has been a beacon of hope for many patients in this region who've been traveling to Indiana for abortion care. What we are doing now and what we have been initiating all across the country is we've created patient navigation teams, and their sole purpose is to help patients access safe and legal pathways to abortion outside of the state of Indiana. Now, we have been doing this in Kentucky for a year. So we are not turning our backs on Hoosiers and their need to access abortion care in the same way far-right extreme politicians have.
We have a question from Zoom. With D. Dotson with WLP on, I think this can be for you, Rebecca, or you. You addressed infant mortality rates in Indiana. Are there concerns about maternal mortality rates increasing with this nuclear ban?
Listen, the maternal mortality rates in Indiana have been increasing. They have increased by 58% in the last 3 years. What extreme lawmakers in the state of Indiana are telling us and telling all of you, they don't care. And absolutely, those maternal mortality rates will increase when people are forced to carry pregnancies that they don't want, or their health or life is at risk.
This is a question maybe for Dr. Q. In terms of that impact, the numbers of the maternal mortality rates is the University of Colorado study, which is 13% increase in mortality, 39% for Black women, Black pregnant people. On a more, I guess, immediate personal level, how will Hoosiers notice in the immediate term the impact of this ban?
What we know is that access to abortion care is required for all people in a community. It is not just about pregnant people that are so impacted by abortion bans. And the way that that manifests is that the entire community's health suffers. When people who are pregnant cannot function, cannot work, They are busy taking care of families that they did not have the control to expand when they were ready. The entire family structure suffers, and all members of the community are impacted by that ban and by that oppression. So when we see, when we're looking at the data around maternal mortality, that is the worst possible outcome, but that is not the only outcome. There are so many other terrible and life-altering moments and things that happen because of abortion bans. And that is where we will first see the impact. And as we study the trends over time, that's when we will be able to trend the maternal mortality numbers. And though we are third in the nation right now for maternal mortality, I fear that we will be in a race to the top with the other states that are banning abortion access.
You guys talked about, several of you talked about some of your colleagues and other physicians discussing leaving to go practice in other states. Can you guys speak to the magnitude of how many of your colleagues are talking about going to do abortions in other states and talking about maybe moving their care to a different state? Speak about the influx maybe that you're seeing.
Absolutely. So I personally am licensed in 3 different states. All of those states I have licenses in because of the need to be able to be mobile and to be able to leave this state if it becomes unsafe. That being said, I choose to stay here in Indiana because this is where there is so much work to do. This is where people are the most affected and the most vulnerable to the attacks by our state. So while we as physicians and as healthcare providers are being targeted and attacked, we also are here for the fight. It is complicated. I have children, I have a partner, I have a mortgage that I'm responsible to and for, and I'm responsible to their safety as well. So when we look at the increase in attacks and harassment of abortion care providers over the last 10 years and how much that has increased, it is scary to decide to stay. And it is an ongoing conversation. And yet this is the work. This is what we are called to do. And it is nothing less than a calling for us to be here and to be a part of the solution to this state-created problem.
You guys talked about Indiana being a beacon for other states to come here to get abortions and other states to ban abortions. Can you speak to how big of an influx you guys have seen to Planned Parenthood from out-of-state abortion?
Yeah, over the past year, we've seen an increase of over 25% in patients traveling into the state of Indiana for abortion care.
Dr. Anderson, a question similar to the one that was just asked about you. You're in a slightly different position than you're younger, you're coming out of your residency. How are you feeling about practicing in the state of Indiana? Quite frankly, do you feel safe practicing in the state of Indiana?
I mean, I think I'm very lucky to be in a position right now to be in the program that I'm in. I feel very protected, very supported by my program. Very thankful for the mentors that I have. Unfortunately, seeing what has gone on in the past year since I've started my residency does make me hesitant. And so deciding where to practice, deciding what I'm going to do for the rest of my life, I've got a couple more years to figure that out, but it's most definitely a consideration for me and my family.
In light of the medical licensing board turning in its final report on Dr. Bernard, what does that have you thinking? Is Planned Parenthood putting in any additional protections for its physicians? Is its medical staff worried that it would find itself in the same position?
Dr. Bernard is absolutely a hero for the care that she provided to that 10-year-old child. Having Todd Rokita take advantage of that and try to politicize it for his own gain was despicable. We will continue to support Dr. Bernard as we always have. And if the AG decides he wants to do something else and come after any other physicians that work with Planned Parenthood, he will be met with the full force and weight of our legal team and our support behind our providers.
What will be the impact of from being able to provide
with this near total abortion ban, more than 90% of abortions in Indiana will be much more difficult to obtain because they were provided in an outpatient setting. And because of decades of literature, medical literature, we know that that is, in many cases, the safest and most cost-effective way and place to provide abortion care, especially in the first trimester, which is what we have been providing in Indiana. The impact of pretending to allow exceptions, of writing exceptions into the law, which are so difficult to understand and impossible to navigate for patients. The impact of that is that patients who deserve abortion care, who need abortion care for their health, for their life, for their family's sake, they will be met with incredible obstacles and challenges. There are some hospitals in the state that are trying to rise to that occasion and trying to expand their access, but that is not enough to absorb the volume of patients that we have cared for historically in Indiana. And it's also not appropriate for us to depend solely on one or two hospitals to take care of all the people in Indiana. So what we will see is that most people in Indiana, the vast majority of people in Indiana who need abortion care, will have to leave the state. And that is, as Rebecca said a bit ago, that is unconscionable, that you can't access basic, safe, evidence-based medical care in your own community.
Hi, my name is Dr. Amy Caldwell. I wasn't planning on speaking today, but I just wanted to step in and kind of on the coattails of Dr. McHugh and say that I am an abortion provider both for Planned Parenthood of Indiana. I'm also a hospital-based abortion provider at Indiana University Health, and we will continue to provide abortion care as we are legally allowed to everyone that we can. We do anticipate there will be many people we cannot take care of, and we are committed to doing what we can for those patients under the legal restrictions that are now in place. Thank you.
This is a question for Dr. McHugh or Dr. Caldwell, both of you.
Sorry, this is the last question to you.
Okay. Hi. As we've gotten closer and closer to this ban now taking effect, what are your conversations with the patients? What are those conversations?
Over the last year, since the discussion last year in the special session, and then the passage of the law, and then the injunction, and over the entire last year, patients are scared. Patients come into our offices and they are worried that they will be arrested just for being there. This legal landscape and the confusion that it has created is not a normal way to provide healthcare. So patients continue to be scared and confused, and they're so grateful and relieved when they have been able to get their abortion care. And then that is immediately accompanied by a fear for what happens to my sister, what happens to my mom, what happens to my best friend. What are we going to do? And so our answer has been consistent, and it is that we will still be here. We will still be here to help get you the care that you need, even if that is not with us, even if that is not in our state. We will be here to help get you to the place that you need to get the care that you need, because that is what we do. That is what we do, is that we show up for the patients when they need us, and we continue to find ways to make it happen for them. So we're there in their fear, we're there in their relief, and we're there in their anxiety and their nervousness about what to come. We're always going to be there.
Don't have any other questions?
Thank you all for being here.
Thank you.